creepy Reddit page about me.
Happy Friday, everybody, and welcome to the internet's favorite show about plastic surgery, health, and beauty. This is Nip Talk. Today's topics, first off, what would a surgeon make for the best survivalist prepper first aid kit? I'm gonna go through all that. Then, what is a hernia anyway? You keep hearing this hernia, what is it? I'm gonna explain that. And then finally, Vanessa Williams saying that she's ditching Botox. What? We're gonna talk about it. It's all coming up right now.
Live from Lincoln Center in the heart of the Dallas Metroplex, this is Nip Talk, an honest and uncensored show about plastic surgery, health, beauty, and lifestyle, with your host, plastic surgeon Dr. Bruce Hermann, and your co-host, entrepreneur and social media influencer Sarah Bennett. Now it's time to discuss the good, the bad, and the ugly of the topics everyone is talking about. It's time for Nip Talk.
Welcome back, everybody. Thank you guys so much for tuning in. We really do appreciate it. Please hit that like and subscribe button. We really appreciate when you do that, and it helps us so much. I'm your host, plastic surgeon Dr. Bruce Hermann. With me, as always, is the wonderful Sarah today.
Hi.
In the box, not Travis. We got Emilio. What's up, dude?
Hi.
What's up? How's it going? Thanks for having me.
Travis on vacation or what?
Yes, he is.
Yeah, I'm about to go on vacation myself. So, well, thanks for joining in, man.
Of course. Thanks for the invite.
We appreciate it. I mean, you've done this before. It's not your first rodeo with us.
No, I think for you guys, I've done three shows maybe already.
Yeah.
So it's good to be back. Good to be back.
Yeah, we're glad to have you back. So, all right. Well, we got some interesting stuff to talk about. So I think we're going to roll into some segments right off the bat here. Now,
what is all this crap?
I know, right? I bought props today.
I was confused when I came in here.
You thought it was the wrong studio? Yeah. Well, let me ask you a question before we start off. Are either of you guys like prepper, survivalist types at all?
I have a safe room in my house.
You do?
And I have a bin with like...
Oh my gosh. Well, this
all the things in it.
Emilio?
Like a go bin.
No.
Nah, okay, all right.
I don't have any of that. I don't have a safety room, nothing like that.
Nothing like that, okay. Well, I have to say, like, you know, my dad was kind of a prepper. I remember when I was growing up, we had this room and I walked in there and I never really thought about it. And one day I noticed like there was all these boxes stacked up and he had bought like all this like non-perishable food, you know, because back, it was like in the 80s, right? So it was like, oh, nuclear war is gonna break out any day. So, you know, my dad was kind of a prepper and I'm not really big a prepper, but you know, the other day I was in the OR and one of the anesthesiologists, he's kind of like a prepper guy, and he was talking about his stuff and like his little, like all the stuff he had, and we started talking about med kits, and I was like, oh, I know exactly how I would do a med kit, you know, being a surgeon who's done like trauma and like reconstruction and all that. So that gave me the great idea to do a segment on a surgeon's take for the best survivalist prepper first aid kit. You like that AI pic I created? Yeah, that was pretty good. So yeah, and so I'm gonna start off with a disclaimer that obviously this is for crazy situations where it's the end of the world, or maybe you're out and you cannot get medical care, because we're going to talk about a bunch of stuff that you really shouldn't necessarily be doing yourself or without proper instruction. But in the case of, you know, hey, there's no more doctors, or maybe you're on a desert island, like these are the things that I would have as a surgeon, as a doctor, you know, with a background in treating all kinds of things. So I thought it'd be kind of interesting. So, sometimes people will give preppers, you know, grief or whatnot, but I mean, we just saw recently in 2020 how society can break down pretty easily.
People get crazy.
Yeah, people get crazy, and you know,
specifically about toilet paper.
I know, I don't have toilet paper in my list here.
No, you don't.
I don't. But you know, I mean, things can happen, and like we take it for granted that, you know, you're always going to be able to, you know, go to a hospital or you know go get food off the shelf or whatever.
Right.
And we've seen that, you know, maybe that's not quite as stable as we thought. So, all right. So if I was going to make a med kit, the first thing I would think about is medications.
Okay.
You know, and this is where, you know, if you're interested in this kind of stuff, I mean, you might actually record this video and write it down, because this really is going to be a pretty thorough medical kit.
Looks it, yeah.
Some of these things might be harder to get, like when you start talking about medications. I mean, there are ways to get medications, and none of this is like anything controlled. But still, medications usually need a prescription. But there are ways around that, you know, internet, other places. But the first thing that I would have is I'd want to have some antibiotics, right?
Yeah.
And I actually thought about this. Okay, say I was only limited to 3 antibiotics, because you can't have like a full pharmacy. I mean, I guess you could, but I guess if you're in your safe room, you only got like so much space, right? And so you want
I have like just a little bitty first aid kit.
a little bitty.
Yeah, like just a basic.
You may
one.
have to upgrade after you hear this segment.
I guess.
So I would start out with antibiotics. I would definitely have Levaquin or levofloxacin. So this is an antibiotic that is extremely broad spectrum. It covers a ton of antibiotics, and it's one of my favorite ones to use. It's 1 pill a day, which makes it easy, which means you're not having to like have 4 pills a day, which take up more room. So I would have Levaquin or levofloxacin, it's a generic. Flagyl, which is metronidazole, which is good for anaerobes and protozoa, which aren't necessarily covered by Levaquin. And then the third one I'd have is doxycycline, because it covers some other things that the other ones might miss, including atypical bacterias, tick diseases, and malaria. So if I was going to have a prep for antibiotics, I'd have Levaquin, Flagyl, doxycycline. I think those are solid choices. I'd have this, ibuprofen. I mean, you'd be surprised.
Everybody should have that in their house.
I mean, everyone should have this in like big bottles, because it's good for pain, it's good for fever, it's good for inflammation. Benadryl.
Yes.
That's another important one. It's good for allergies, if you have an allergic reaction, or even it can be used as a sedative. Imodium, if you get like beaver fever or something and you start having like big diarrhea, you can get sick really quick. So you want to have something antidiarrheal. Antacids, maybe including things like proton pump inhibitors. So that'd be, what's the big one? Protonix and Prilosec.
Okay.
Those would be good. Antifungal creams would be good, because if you're out somewhere where you can't, necessarily keep us clean, fungus infections are common on the skin. Steroid creams, I'd even have a Medrol dose pack, which is basically oral steroid pills, because if you have some bad reaction, like say you get into a hive of hornets and like you start swelling up, that'd be good. EpiPen, which I brought one here, I'd get one of those, because that's good for lots of situations.
I have one of those.
Do you?
Yeah.
In your little kit?
No, I don't have it with me in there, but Avery had one.
Yeah, it's good to have. I'd have anti-nausea medications as well, because if you got really sick, I think in like a out in the wilderness scenario, or end of time scenario, things like throwing up and vomiting and like diarrhea get you dehydrated really quick, and you can get sicker much easier. So you'd want to have some medications to combat that. Multivitamins. If you are in a place where you can't get great nutrition, you're maybe not getting all the vitamins you need, so I'd personally have some multivitamins. I'd have Silvadene, if you can get it. So that's basically.
What the heck is that?
It's used for burns. Sulfasalazine.
Okay.
Great. It's like the absolute best medication for putting on burns. And it's not that hard to get. I mean, it's not like super expensive or anything. I think you do need a prescription for it. I'd have lidocaine. This is great for if you need to do any type of minor procedure stuff. Like this is numbing medication.
Yeah.
So like, hey, you have to pull your own
But
tooth.
you can't get that at Walmart.
I don't think you can, but once again, there are ways to get stuff that are, not necessarily super shady. But we're talking about end of times here, right?
Yeah.
So lidocaine. This one does not have epinephrine in it, which is a vasoconstrictor. I would personally get one with epinephrine. Let's see, betadine. Let's see, I had some betadine here. This is betadine swab sticks.
Yeah.
So this is really good for cleaning wounds, or if you have to do like a minor procedure on yourself, like stitch yourself up. This is great for prepping skin. It kills lots of bacteria. Alcohol wipes, which I have somewhere here, are good. Also good for cleaning skin, cleaning wounds.
Definitely.
You can buy these in like little prep pads. This is one that is important. This is called Dakin's solution.
I thought that was hydrocortisone before, because I didn't see the label.
Oh, no.
Not hydrocortisone, hydrogen peroxide.
Similar. So this is actually sodium hypochlorite, which is dilute bleach.
Okay.
We use this a ton for tough wounds or wounds that have infection. You can literally buy this off the internet. We keep this stuff all the time. It's great for cleaning wounds and also wound care.
What's that? Because I remember whenever a person in my family got staph and MRSA, or staph or MRSA, and they had to wash themselves in that
Hibiclins.
Yeah.
Yeah, I'm not a big Hibiclins
that
fan.
good?
So, I mean, it's okay. So I would use Hibiclins in the same way that I use these betadine swab sticks, which I'm not sure what I did with that. Oh, these.
Yeah.
So that's kind of the same use. You know, Hibiclins is not great necessarily for wound care. It's a little overly aggressive, in my opinion. You'd be using it for the same thing you'd be using this iodine, but this is easier to come by.
Okay.
You know, the only time I'd use Hibiclins if somebody was allergic to iodine.
Okay.
But that Dakin stuff is great. I would definitely have that in my prepper kit. Normal saline, this is good for irrigating wounds. This is free saline. You can use it for dressing care. Love the stuff, use it literally all the time. I'd have IV bags as well. Now you have to have some skill to start an IV, but it ain't rocket science. Like if it's end of times and
Find a vein.
yeah, you can find a vein. Like seriously, there's books out there that can teach you how to do this. Once again, please do not do this at home unless it's literally like the end of the world or like you're on a desert island. But I would carry IV fluid bags because if you get sick, this can make the difference in life and death. You know, if you start to, well, yeah, if you like say you lost some blood, you start to lose volume, or you know have bad diarrhea. You know, having IV saline, which is totally different than this, you would not want to put this in your veins.
I know that saline's probably more effective, or IV bag, but what about those little powders of that rehydrate you? Like those
Oh,
little,
the Gatorade powder pouches?
well, they're not Gatorade, but I forget what they're called. I have them at home, and I
For
do
like
some-
working out?
Yeah, so it's like they're really salty drinks.
Liquid IV.
Yeah.
Liquid IV.
Yeah, those
Yeah.
are good for hydration.
Yeah.
Really? I'm not familiar with those.
Yeah. So I take them all the time. Like if you drink one of those, I guess it's not TMI, but if you are out drinking and you drink one of those before you go to bed,
Yeah.
it like lessens your hangover.
Interesting. And what's it called? Liquid IV?
Yeah.
And it's like a powder you put in water?
Yeah, but there's a lot of different brands.
Huh. And so
And
what is
I
it, like
always have
electrolytes
it.
and
Yeah,
stuff?
it's electrolyte.
Oh, so it's
powder.
basically taking normal water and turning it into electrolytes.
Yeah.
Yeah.
So like I always get them free whenever I go to like CrossFit things. They, like,
Interesting.
just throw.
I don't
them
know a
out
lot
to
about
you.
those, to be honest. Yeah.
Yeah.
Yeah. I'm gonna have to look that up. But it's probably not a bad thing because I mean it's.
I mean, that would
It's
probably be a good
hydrating you.
thing to
Like
have.
the water is hydrating you, but that's giving you electrolytes, which is
Yes.
important because
It
you
helps,
know.
like, it just helps it
keeps things
better.
stable. Because if you just drink, you know, if you drink tons of pure water, I mean that's actually harmful to you because it decreases the osmolality of your blood, meaning you're starting to dilute like your sodium, your chloride, and then you can start to have issues from that. You know, you can have like nervous issues, cardiac issues. You know, it's actually dangerous to drink pure water in like huge amounts. You know, remember the girl that died from drinking like 6 gallons of water at once to win a Wii or something, like a Nintendo Wii? You guys don't remember that?
That would never happen to me. I'm always dehydrated, I think. I don't drink enough water at all.
Yeah, I don't really drink a ton of water either, but I mean, just like everything is toxic at a high enough dose.
Yeah, for sure.
Oxygen, water, all that. But by adding that electrolyte stuff, you counteract that. So yeah, that would be good to have because you could add that into your water.
Oh, we got it.
Nice. So that's kind of rounds out the medications that I would have for the most part. That would cover a lot of stuff. You could actually do a lot with that. So then I thought, okay, what kind of instruments or tools would I want? So I would definitely have a pair of these. These are trauma shears. These are great for cutting clothes, you know, cutting bandages. We use these all the time in basically every clinic I have. These things are super strong too. You can actually cut like a penny with them. Not that I would ever cut a penny because that's against the law, but theoretically you could cut a penny with this. So these are really good. I would have instruments for doing minor procedures. So these are disposable scalpels. These could be very, very handy, like if you were injured. These are some of the instruments that I use all the time. This is basically a hemostat. This is good for if, like, say you got cut and you were bleeding, you can actually kind of clamp the blood vessels off and you can control them with that. These are needle drivers for suturing, pickups for holding tissue. Definitely have some of that. I didn't bring like surgical scissors. I would definitely have a pair of those. I actually meant to bring a pair and I forgot. If you're gonna have instruments, then you probably wanna have suture. Now, obviously you're not gonna have as much suture as an OR would have, but I think you could pare it down to like just a few. So I would have some Vicryl in there. This is absorbable stitching. You can use this like internal body, like if you had like a deep cut and you had to close some of the bottom, you could use these. Also, like if say you had a cut like on the inside of your mouth or like, you know, rectum, vagina, like places where you wouldn't have to take stitches out, like this stuff works good. Nylon suture, this is just the basic suture that you see all the time. This is great for closing wounds. So I'd have these two. I'd bring some Dermabond. This is skin glue, for minor injuries. This is really nice. I think you can pick this stuff up. It may not be that brand, but you can definitely pick that up. Let's see what else. So tourniquet, so both like a surgical tubing tourniquet. This is a finger tourniquet. These are great because fingers are really common to be injured, and fingers bleed like stink, and it's hard to repair something when it's bleeding. So I would have one of these that you could just roll on a finger to fix it so it wouldn't bleed out on you. Splints, so this is just a finger splint. Once again, fingers are commonly injured. This would be if like you had a fracture or like a cut and you need to stabilize it. I would also have like splinting, like if you needed to splint like an arm. Now, I didn't bring any with me, but the one I use all the time is Orthoglass. Basically, it's I'm not exactly sure what it's made of. I think Orthoglass is the name of it. That might be the trade name. But basically, it is a dressing that when you apply warm water to it, it hardens in about 2 or 3 minutes. Oh, okay. So like if you had like a fracture, and you were able to set it, then you could put the, first you would wrap in something like this gauze, and we'll go over like the gauze and stuff I'd have, but you wrap like gauze over it, then you could put the you dip the Orthoglass in the water, you wring it out, you put it on here, and then it'll harden, and you put like an ace wrap or something around it. So that would be definitely something I'd want to have. Needles and syringes, these are important for irrigating wounds, and also if you need to give yourself lidocaine, so I'd have some of that. Of course, you need needles with that. I would bring a headlamp. Yep. You got to have light to do some of the stethoscope, thermometer, blood pressure cuff, O2 sat monitor, that's important. Yeah. These are all things you can buy. I mean, I know it's getting kind of crazy, but like
I wonder if like all this stuff is like found in like military medical staff, like people
Probably,
that are like on the field that are like.
I bet they have a lot of this stuff.
What are they called?
Medics?
Yeah.
Yeah, medics, field medics.
Yeah, I wonder if they have that in their bags. Like
what's interesting is like I was like, okay, well maybe they have kits that have all this stuff already in it. So I went on a couple of web pages and was looking at, okay, prepper medical kit, and it was trash. At least the ones I saw, and they were expensive. Like they were, $100, $200, which I mean it's not super expensive, but there was a lot of stuff that was not in there that I would definitely have. It was just
I probably have one of those.
Prepper kit. Like
just a regular like
first aid kit. Yeah.
First aid kit.
Yeah, I mean it had things like gauze and stuff like.
I have a toilet though.
In your safe room?
Like a little toilet that you'd go camping with. Oh. Because I was thinking.
That would be important.
Because I was thinking about that, and I was like, I have a little girl.
Yep, she's gonna have to use the restroom.
Yeah.
I mean, there's a lot more to like prepping than just medical kit, obviously, but all right, and gloves. You want to have some gloves. So these are great. These are sterile gloves. Like if you need to do any like minor procedures, they just come in like these little peel packs. Awesome. And you also probably have some non-sterile gloves just for doing other stuff. And then finally, like the other supplies. So this would be like your gauzes and stuff. So this is where it can get a little complex because there's so much stuff out there. These little cotton tip applicators are great. This is good for like cleaning wounds, also placing dressings. I definitely have some of those. I would have 2 types of gauze. This is called woven gauze. This is great for wounds, and it's called woven because you may not be able to see on you can see through it on the camera. Yeah. You can see how it's like it's woven. It's not thick like a paper towel. So this is non-woven gauze. So I use this a lot for wound care because it's great for the surface area. This is good for like putting on top of dressings. This roll gauze is fantastic. Like if you're injured, have a wound, you can roll this stuff around, your extremity or whatever you need. This is called Kerlix, Kerlix. Use this stuff a lot. Petroleum gauze is good. That's good for like abrasion type stuff. We use this all the time. Xeroform is the brand name for that. ABD pads are great. So these are absorbent dressings you can put on top of stuff. I use these a lot. So something like I might use this gauze and then some of this on top and then put this to soak up anything so it doesn't get wet. Other things, this is called Coban or vet wrap. This is great for applying.
That's sticky.
It is. It's slightly sticky. It sticks to itself, but not necessarily anything else. You can literally buy this at any pharmacy. You use this all the time. So Coban or vet wrap is great. And the last couple of things, like little sterile drapes. These are good if you need to do any procedures. Steri strips. So these are like, you ever heard of butterfly?
Butterfly.
These are similar. Tape. Yeah, these are similar to that. They're not really. They don't have like the thin part in the middle, but they're great for approximating like little injuries. or like after you suture something up, you can put these on there. And then iodoform gauze is great. This is strip gauze if you have like little small puncture wounds. Works really good. So yeah, I was kind of being thorough. I was like, okay, well, and the last one, silver nitrate. So this is actually a chemical cautery. So like if you have bleeders that you can't stop and you don't want to like, suture them, this silver nitrate's great. It almost is like a chemical cautery burn. So it's good for like bleeding, bleeding stuff. So I try to be pretty thorough. I don't know, did I miss anything? Sarah,
Shoot, I don't know.
Sarah, you're in medicine. Yeah, heck, you even got your own safe room. I thought for sure like you might be like, you forgot the Dumaflage, no? Think it's pretty good?
I mean, you could do a lot of stuff.
You could. If you had all this stuff, you could handle, most infections, most injuries that weren't like internal. I don't think that this kit's going to save you if you, have a penetrating chest wound.
And whenever you're talking about all the antibiotics, it makes me want to like save one or two pills from each time I get prescribed antibiotics just to save it.
I mean,
create a collection.
You can buy a lot of this stuff online. I haven't personally tried, but I know that you can get antibiotics various ways, or if you have a good relationship with your doctor, sometimes they might give. And these things keep for a long time. These medicines, they'll have an expiration on them, but I would never encourage someone to take expired stuff. But we're all kind of postulating about an end of the times, scenario
this is
here.
Down to the wire.
Down to the wire, the zombie apocalypse. You're playing Crash on an island.
You don't care about expiration dates.
You don't have to care about expiration dates. Yeah, exactly. No. But yeah, you could do a lot with this. You could take care, if you had the know-how, and obviously, if you're going to go to the trouble to make this like crazy, med kit, you're going to have the books. It's like, how do I suture myself?
Yeah.
And you'd be like, oh, I have all this stuff. I can do that. I can.
Yeah, I've bought. I don't know if I still have it, but I have the survival book that tells you how it goes from what to eat in the woods, how to kill animals, and then to how to take care of wounds and all kinds of stuff.
Yeah, it's good to know. You never know, when something happens, you're, out in the middle of nowhere, a car breaks down, and, once again, obviously, if you're ever sick, you need to, if at all possible, see a doctor as opposed to treating yourself. But there's
I'll come to your house at the end of times if I need to.
Right. Yeah, I'll have all my prepper stuff ready. But yeah, that happens all the times where people get caught out, somewhere, or something happens, and it's either do or die, right? And so having some stuff available and having some knowledge, it can make the difference between life and death. So yeah, that would be as a surgeon, this would be my Survivalist prepper first aid kit. And it would be big. I'd probably need a duffel bag really to carry at least a duffel bag, maybe a couple, because I'm going to have more than one, bottle of saline, more than one bag,
Yeah.
I can imagine if I was going to do, a Survivalist prepper first aid, it would probably be at least a couple of duffel bags full of stuff. I just want to be able to prep for anything, right?
Yeah.
I'm not really a prepper. I've always thought about that, what would I do? And I'm like, I'll get around to that sometime, and
I'm not a prepper. I just have a bin. It's literally just a normal packing bin. And it just has
That's great.
That's all I put in there was just what could fit.
There you go.
That's it.
At least you have something.
Yeah.
Amelia, you have to step up your prepper game here. Yeah, Sarah's outshining both of us, honestly. I need to step mine up. I have the knowledge, I just don't have it collected.
I don't have anything. I don't have a bin like Sarah. I don't have duffel bags like you. And most of those, what were they medicines, antibiotics, whatever they were, you were listing them off. Back here, I was just I have no clue what any of that is.
I don't even think I've been.
You can record the episode, Emilio, and save it to your phone for the end of times.
I will. I was thinking about rewatching it, writing everything
Maybe
down.
Next week I'll do a segment on emergency care of something.
Yeah.
But
fun. To be honest, the only reason why I have a to-go, a end of times bin, is because I made a YouTube video about it.
Oh, did you?
A long time ago. Maybe 2 years ago.
Oh, that's cool. It just popped in your head, I'm gonna do a video about my end of times bin.
Yeah, I used to just make random videos about random stuff.
Well, hey.
Back in the day.
Yeah, content's content.
Yeah, pull that YouTube video out, paste it in here so everyone else could see it. Compare different safety bins or whatever and see which one.
I guess if you were really going to do like a sick prep for it at times, you'd probably get like a massive hard drive and download as much information as you could off, like, I guess, Wikipedia, or there's probably some books or something.
Download ChatGPT.
Yeah, somehow, some way.
Have my own ChatGPT.
ChatGPT, tell me how to do this surgery.
How do I do this surgery, ChatGPT? It probably could walk you through it, honestly.
True.
It'd be like, well, you really shouldn't do this. Like, no, this is just, you have to like trick ChatGPT and tell it, I'm not really doing this, ChatGPT. Hypothetically, what would I do if, I've had ChatGPT, I've asked the questions like, sorry, I can't tell you. I'm like, well, let's pretend. And he's like, oh, okay, sure.
Yeah.
But
like a child.
I know, right? He's like a child. Well, listen, let me know if you are somebody who is a prepper or survivalist and you have a kit like this. Let me know if I missed anything, or if you have questions about the stuff I added. I'd love to hear from you, so leave us a comment. So, all right, let's move on to a medical topic, which, all right, I'm going to ask you guys a question. If I said, tell me what a hernia is, do you guys know what that is?
Yeah,
You do know?
pretty much.
Amelia?
I don't know, like, I couldn't tell you the definition, but I know what it is, if that's okay.
So, and a lot of times I get these segments from patient interactions. So I was doing a tummy tuck the other day, and unbeknownst to me or the patient, she had a hernia. And so I, given that I was general surgery for plastics, I just repaired it. I don't call anybody in to do that. And so after she went home, of course, and then when she came back to follow up, I was like, oh yeah, by the way, you had a hernia. And she's like, what's a hernia? I'm like, oh. So I had to explain that. And so I do think that hernia is something that is a little bit of a nebulous term. And so I want to explain in this segment what exactly is a hernia, what does that mean, what are the types, what are the symptoms. So, all right, so so if you're gonna like try to make a definition for hernia, like the best way to say it is a hernia is defined as tissue, which can either be fatty tissue or intestines or potentially other organs, squeezing through a weak spot in muscle or fascia, and fascia is connective tissue, that it shouldn't be able to squeeze through. So it's basically when something in your body is going through a wall that should be a blockage there. And so, if you have a hernia, it could be asymptomatic. Like a lot of people will come into my office, and kind of spoiler alert to one of the hernias that's very common is umbilical hernias. We'll talk about different hernias. And like I'll be doing an exam for something like a tummy tuck. I'm like, oh, you have a little hernia. Did you know that? And like, no, I had no idea. In fact, I have a little one myself. I have a very, very tiny umbilical hernia that I can just barely feel. Like it's not anything big. I've considered maybe going and have somebody take care of it, but it doesn't bother me, so I haven't done anything. But the signs and symptoms that if it's not asymptomatic, then what you would feel is a bulge somewhere, like on your body. Like say, for example, my belly button. Mine's like really tiny. So, and the only reason I know it's there because I have the knowledge to know. If I didn't know, I'd never know it. But somebody who has like a bigger hernia would feel a bulge or a ball where there shouldn't be one. And it can change in size. Like if you're doing something strenuous, like lifting weights, that's how I think I got mine, because I used to lift a lot of weights, and that intra-abdominal pressure pushes against weak spots. And once again, jumping ahead to a type of hernia, the umbilical cord travels, that's what your belly button is. It's the remnant of where the umbilical cord went through, and that seals up after you're born, but not always 100%. And so if you lift weights your entire life, or pregnancy, that's one too, increased intra-abdominal pressure, it pushes on that weak spot, and where it should seal up, it opens up a hole, and then stuff can get through it. Right. And that's a really good way to think about hernia. So where do they happen? Like the abdomen is the most common location, and we're going to kind of go through these different types of hernia. And it can be a little confusing because you can have internal hernias as well. And the first one I'm going to talk about is an internal hernia. So this is called a hiatal hernia. I got a picture, Amelia, throw that up there. All right, so what we're looking at here is a cross section of the chest, that kind of pink, broad muscle.
Looks uncomfortable.
Yeah, so that's the diaphragm right there.
Yeah.
And so you see the stomach is both below and above the diaphragm, and it shouldn't be like that. The esophagus turns into the stomach, and that junction between the esophagus and the hiatal hernia, which is the upper part of the stomach, should be right where the diaphragm is. But what's happened is that hole where the esophagus goes through the diaphragm has gotten too big, and now the stomach is getting up into the chest cavity, like the mediastinum. And why that's a problem is because there's a natural sphincter there where that muscle is, and when you get a hiatal hernia, you get really bad reflux.
Yeah.
And so this is something back in my general surgery days that we would fix very commonly. We'd basically have to do surgery to fix it. you would usually do it laparoscopically with a scope, pull the stomach back down, and you would suture repair that diaphragm to prevent it happen. So that's a hiatal hernia. That's more of an internal hernia.
How does stuff like that happen?
So it's a natural weak spot there, right? So the diaphragm is a big, broad, thick muscle, but there's a hole through it because the esophagus has to travel from your mediastinum, which is the central chest area, into your abdomen, and there's a hole at the right there in the center where the esophagus goes through, and that's a weak area. And as intra-abdominal pressure increases, it's constantly pushing against that. You think of it like a seal, right? And just like the seals on like your car, like little O-rings and whatnot, enough pressure eventually can break that down. And then the intra-abdominal pressure is higher than the mediastinal pressure, so it's physics. High pressure to low pressure. So you're pushing something from a high pressure area to a low pressure area.
Right.
Does that answer it?
Yeah, I guess. But I'm thinking like more of along the lines of like a normal, like average healthy person is not going to get one of those, right?
I mean, it just depends. I mean, just like, a new car, like a human body can have defects. I mean, and so, you may not have as good of a seal around, your diaphragm as the next person does. And also like your lifestyle. I mean, you're at risk for these, being a weightlifter, me too. It's like, I didn't have an umbilical hernia when I was a kid. Right. It developed over years of lifting weights and, that strain of, when you're lifting a weight, you're pushing and,
Do weight belts help?
Weight belts is more for protecting your back. Like it's the intra-abdominal pressure, like that valsalva, almost like when you're having like a bowel movement, you're pushing. Like when you lift weights, you're doing that same thing. And so you're pushing on all of those potential weak spots in your abdomen. We'll kind of go through all the different ones, but it's the intra-abdominal pressure from that strain. So hiatal hernia, very common. That has to be repaired surgically. Pretty much all these have to be repaired surgically. Another big one is inguinal hernia. All right, so throw up an inguinal hernia. So this is where fat or intestine protrudes through the inguinal canal, which is a natural pathway that goes from the abdomen to the testicles in men. It carries the spermatic cord and the vessels and the round ligament in women. So there's a natural hole in the abdominal wall, which should be pretty small, because it really only needs to travel like blood vessels or in men and the vas deferens or ligament in women, sorry. And so there's a natural kind of pathway through there, and same thing, increased intra-abdominal pressure pushes on that natural defect, and you can actually get intestines going through. And so I repaired these a ton when I was in general surgery. More older people, years and years of intra-abdominal pressure pushes against that. And how it feels is you'll get a bulge in your groin, like that crease. The inguinal canal is basically right above like the crease of your groin, and you literally will get fat or intestine in there, and it feels like a bulge there, and it can be painful. And
it looks pretty gross.
Yeah, and so that also has to be repaired surgically. One very similar to inguinal canal is the femoral hernia. I think I got a picture of that one, Amelia, throw that one up. So you see that thing that says inguinal ligament. So the femoral canal is below the inguinal ligament where the femoral blood vessels come out. So that's an artery and a vein. There's a natural space there, and things can go in that. It's not as common as the inguinal. The inguinal would be above the inguinal ligament, and it actually travels along the ligament. The inguinal ligament is like part of the boundaries of that inguinal canal.
Can you still like detect it?
You can feel the bulge down low. It'd be a lower bulge. Those are pretty rare. I've repaired, went back in my general surgery days, like a few femoral hernias. They're not near as common as inguinal because I think it's a smaller track, and it's harder for stuff to get through. Another big one is incisional hernias. So basically an incisional hernia, yeah, right there. So if you have surgery, and this could be laparoscopic surgery or open surgery, when you have surgery intra-abdominally, they actually cut the muscles of the abdomen, which is that layer that we're talking about that prevents things from getting through. And if, say, for example, you had an infection, then it would actually break down that muscle layer and make it vulnerable, and then you can actually get things herniating through where an incision was placed. And we see this all the time. These are actually very common. And of course, there's risk factors for it. People who are heavier, diabetics, smokers, they're more prone to have these incisional hernias. These ones can be huge because depending on the size of incision was made, like if it's a laparoscopic surgery, those incisions are small, but like if you have like an open abdominal surgery for, I don't know, like you're in a car wreck and they got to take out your spleen, like that's a big incision. And you could potentially have like that whole thing open up internally and then push stuff out. And I've seen some crazy incisional hernias over the years. Like, I mean, stuff that where it's like, they have just like loops and loops of intestine.
Is it common with like mommy makeover, tummy tuck things?
No, because in a mommy makeover, we're not going through the abdominal wall.
Okay.
In fact, we're repairing the abdominal wall.
Yeah.
Part of a mommy makeover is as pregnancy stretches out that abdominal wall, it gives that push to the abdomen. And so what I do in a mommy makeover is actually repair that and pull it together. Mm-hmm. So yeah, nice. That would be that'd be something different. Mommy makeover is not going to give you a risk of a hernia.
Cool.
I do find hernias, not uncommonly.
Doing that surgery.
When I'm doing that surgery.
Yeah.
And, because I have a general surgery background, I just fix them. I don't call someone in to do that. And then the last one, and there are other hernias. These are like the major ones. There's like some really rare ones like Spigelian hernias, and you can have like internal hernias where your intestines kind of loop on themselves. But the other really common one, which you've talked about, is umbilical hernia. Yeah, right there. And so that's the remnant of where the umbilical cord from your mom's placenta goes into you to supply the blood, and normally that shuts down, but there is a weak spot there, and either pregnancy can open it up, which is very common. I see a lot of women who are post, kids are coming in for a consult for tummy tucks or lipo or whatever, and they'll have like a little hernia. You'll feel like a bulge basically right at the base of your belly button. Like I said, I have one myself. Like it's really small, it's not getting any bigger. I'm probably not gonna do anything about it, to be honest. So like what can happen with hernias, right? So like what is the risk? Well, they can be uncomfortable.
Yeah.
You can have pain from them if they're,
Pictures definitely make you hurt when you look at them.
Yeah, you see the pictures like that can't.
Looks uncomfortable.
It can't be comfortable. And so kind of the risky thing was with hernias if they get incarcerated. So incarcerated means that the stuff pushes through, but it can't get back.
I was like, they're going to jail?
That's right, you're in jail, buddy. But no, so we call hernias reducible or non-reducible. So if it's not reducible, I mean you can't push what's supposed to be on the inside back in. That's called an incarcerated hernia. And that becomes a little bit more concerning because it means that this stuff is now trapped outside, and then it can progress on to being strangulated, which means that whatever's going through that hole, the opening gets too tight and then actually cuts off the blood supply. Mm-hmm. And then people can actually have things like dead bowel, which that's a medical emergency. You can die from that. And so that's why hernias can be potentially risky. Now, if you have like a little tiny hernia, you're probably fine. But if you find a bulge on yourself, whether it be like groins really common or on an old incision or the umbilicus, it's probably worth mentioning to your doctor, just to make sure it's not something significant enough that's going to put you at risk. Like I said, mine, I know for a fact that, mine's so small, it's just probably just a little like omental fat or something that I have. I mean, it's like the size of a pea, like it's nothing. Right. But if that were to get bigger where you could actually get a significant amount in there, I mean, it could be potentially, harmful. And so I would, consider more about getting it fixed. But asymptomatic hernias are very common. Like I said, I see them all the time on women when I open people up for tummy tuck, all the time being, maybe 1 out of 20, I'll find a hernia. It's like, oh, you had a hernia. And normally it'll be, I always check them for umbilical hernias. We're the ones I find that I didn't know they had. It's like if they have an incisional hernia. It's from laparoscopic ports, really common. Laparoscopic port makes a small incision into the fascia, and then so for whatever reason it doesn't heal, and then something pushes through, and it's like, oh, you had a hernia. But so do you feel like I mean, you already kind of knew. Emilio, you know what hernia is now?
A lot more, yes. And you couldn't see me, but when you had those pictures up, I was just like, gross, this looks painful. I don't want to experience this. I had a friend.
You weren't about to go down, were you?
No,
okay.
I was fine. No, but I had a friend way back when he was lifting weights and he had too much weight to where he gave himself, I think, 4 hernias.
Oh, wow.
Yeah.
That's crazy.
It was bad.
Yeah, I mean, lifting weights is a big risk factor. Like risk factors for hernia, I mean, it can just happen even without, having risk factors, but, pregnancy, weight gain, lifting weights, anything that increases your abdominal pressure, puts you at risk for hernia. Like weightlifters for sure, they're at risk. I know that's how I got mine.
Yeah.
Because I didn't have it when I was like in my teen years, and it just over the years of lifting, which I obviously am not like lifting right now. I look like a stick figure, but in my lifting days, I actually used to lift pretty commonly, and so I think that's
like with weightlifting too. What I've seen is that whenever you do have a lot of heavy weight, I always hear like you have to like basically flex or like prep your abs before you lift the weight.
Yeah, that might help.
And then that way, you don't really give yourself a hernia since you're flexing your abs. I guess it like pushes back.
It helps.
I'm not too sure. Yeah.
I'd have to look that up. I'm not sure about that.
That's
A
what
strong core is always helpful.
Yeah, strong
Yes.
core is
For
good.
lifting weights.
Yeah.
Yeah.
So.
Yeah, for sure. Well, anyway, I think now at least people have a general idea what a hernia is. Like, I think pictures are helpful description. So, you know, when you hear people have a hernia, at least now you like, because I remember like when I was, like before I was in medicine, I'd heard the word hernia and like I had no idea what that was. I was like, I don't even, like the concept of it was just lost to me. Like when I was in college or, you know, high school, you know, it's like, oh, Uncle, you know, Cletus
Lift the
has
couch.
a
a hernia now.
has a hernia, right? Yeah, I'm like, I don't even know what that means. I have no clue what that is. So hopefully we cleared it up. People are educated on hernias. So let me know if you have any more questions about hernias or if you ever had a hernia, anything experience you want to drop us a comment. We'll answer you. So, all right, moving on. We got a celebrity plastic surgery story.
Let's hear it.
You guys know Vanessa Williams?
Yeah.
You know her?
Yeah.
Amelia, Vanessa Williams?
No.
No, okay, so she's a little bit older. Like she's 61 now. She was a singer. She's also done some acting. She was Miss America. I think there was some scandal or something though. She might have been the one that was like in one of the nudie mags. I can't remember, but
I couldn't tell you.
yeah.
I feel like she's more known for being an actress.
Well,
At
I
least that's
remember
how I
her
know
for
her.
like her song. I remember Vanessa Williams' song, like the "Save the Best for Last." Like that's like her big one. I mean, it's like an '80s kind of ballad or whatever, maybe
Before my
early
time.
'90s.
Same. Yeah.
I know, I'm just old. I'm sorry. But anyway, Vanessa Williams, she's a known person, actress, you know, singer, former Miss America, went on the record, People magazine this last week saying that she is swearing off Botox. She's ditching the Botox, no more. Which is interesting because, this is a change of pace for her. Because there was an article just out a couple years ago where she was quoted as saying her top beauty secret was knowing where to get good Botox. And there was a picture of her when she was having her Botox. Love that first picture. Yeah, that's her. And you can see it, like, well, I can see. Like, she's got the classic kind of Botox look. She's got a perfectly smooth forehead, perfectly smooth glabella, which is between the eyebrows. And you can just see a little bit of
expression
on her lateral forehead, and that's good Botox. I mean, you know, her forehead looks good, but she I can just tell by the way that she's got those wrinkles that she is going to be able to do facial expression, but she's also going to get maximum smoothness. And you see she has no lines in her eyes. And she was almost 60 in this picture. I mean, she looked great. Like,
yeah.
I've said this many times that, you know, Botox is like super low-hanging fruit for looking young into your older years. So I was a little bit, curious why she was giving it up, and she didn't really have a great reason except that she said she was going to embrace getting older, which is fine. I mean, you know, I'm not like dogging her for giving it up. I just thought it was interesting. She said that she still was going to get various other treatments, including microcurrent, which I don't know if she means like Morpheus or laser by that. I mean, that would be like a skin tightening procedure, I would think. Yeah. And she's going to focus on staying healthy and fit. She's really into exercise. Which I think is great. I mean, that's absolute important, you know, for your health, not necessarily your appearance, although it does help with your appearance.
Definitely.
But, you know, my thoughts on this, I mean, yeah, whatever she wants to do, right? Like, I'm not out there saying that everyone needs to be on Botox, but, you know, I do think it's a bold move for her. I mean, being a celebrity where people always, you know, judge your looks.
She's probably been getting Botox for a long time.
Yeah, she has. And what's interesting, you know, and she looks amazing. Love that next picture. This is her just recently. I mean, she looks fantastic. She's 61 years old, basically has no wrinkles in the upper areas, like where you would normally see wrinkles on someone that age. Well, what's interesting is, you know, now that she's swearing off Botox, what's going to happen is, you know, she'll be able to move her muscles, but because she's been using it so long, and you can just tell she's been using it for a long time by looking at her at 61 and the fact that she has 0 wrinkles on her forehead or between her eyes, like, it'll take a lot of time for those wrinkles to kind of form, you know? And so she's going to continue to look good for a long time, even though she's not using the Botox, but it's because she was using the Botox for so many years. Yeah. You know, she's already put the time in.
She's going to be aging extra gracefully.
Yeah, she will.
Maybe it's just like a point in her life where she's just like, you know, this really doesn't matter to me anymore. And I feel like that's at some point, at a certain age, when you, whatever you feel, you're like, I don't need to do this anymore.
And that comes at a lot of different ages. It's funny you say that, you know, because I'll have people come in, you know, to my office and, you know, for example, I'll have somebody come in, it's like, you know, maybe 60s, and they have breast implants in, and they're like, I just want to get them out because I just don't care what I look like anymore. And and like whatever people want to do, but that age at where people say, I don't care what I look like anymore, varies so much. I mean, I think that there's people in their 30s that probably say that.
I don't think that's a healthy thing to say, but I don't think I don't think people should be going around saying I don't care what I look like.
Yeah, because I mean that potentially could bring up health issues. I mean, I'm not talking like aesthetic stuff, but like if you let your weight get away from you, like that's obviously not healthy.
Yeah.
But yeah, it's very interesting that people have different ideas of, okay, at what age am I not going to care what I look like? I don't know. Like I'm pretty vain, I think. I think I'm gonna and I don't even use Botox, although my office people are telling me it's about time. But I feel like I'm gonna I've had women in their 70s come in, and have aesthetic surgery. I mean, that's actually not uncommon because people are living longer, and people are healthier these days. And 50 years ago, I mean, I think most people in their 70s were probably like in a nursing home, but now you got like people in their 70s or even their 80s, like they're out playing pickleball and like having this great social life, and so they want to maintain their appearance.
Yeah. I think a healthy self-preservation is good, and maybe she's just past that point of,
Yeah,
I'm not on TV anymore. I'm not trying to keep up with,
Yeah, keep up with everyone.
Yeah, and I'm just gonna chill.
Yeah, maybe. I mean, it is kind of like a hassle to have to come in, twice a year to get Botox. I mean, and it's
like
weird.
She's like, I'm ready to age now.
She does look good for 61. I mean, she looks great. She's really hanging in there, and I think that all the treatments she's done over the decades have that's played a part. I mean, she's obviously a beautiful woman. I mean, she was like Miss America or whatever, but doing those treatments when you're young, like it pays dividends.
Yeah.
And
that's why I started doing it.
Yeah, I mean, it will pay dividends. And the thing is you don't realize it because once you start down that pathway, most people will stick with it. And then, they end up, turning 50 or whatever, and that's just how they look. And they never know what they would have potentially looked like if they hadn't done that. My wife's like a good case example of that because she's been using Botox since her early 30s. But just like Vanessa, I mean, we're both a lot younger than Vanessa Williams, but like the same thing, like my wife has basically got no wrinkles, and naturally I think she looks young naturally, but like definitely these treatments are helping.
Yeah.
She looks unnaturally young.
Good.
So, yeah, I mean, it's good, right?
Yeah.
But yeah, Vanessa Williams swearing out Botox. We'll see if she sticks with it. It'll be interesting to see, if we're still doing this show in a couple years, I'm gonna look her up and see if, because I can get on her Instagram and look at her. I'll be able to tell if she's, I can pick out Botox very, very easily. Even good Botox, which you probably can't do at this point. You've seen enough. Amelia, can you tell if somebody's had Botox? I mean, you probably tell bad Botox, right?
Bad Botox, yes, but good Botox, no.
Yeah, good Botox. Good Botox shouldn't draw attention to itself. You should have enough expression that that people aren't going to say, oh, you have a frozen face, but also it should be good enough that you just don't see the wrinkles.
Yeah.
Yeah.
I think Sarah's Botox is good. I mean,
I didn't even know she had Botox until she mentioned it. So
yeah, like hers is really good because she doesn't look unnatural at all, but she's just got perfectly smooth, and a lot of for her, and I hope you don't mind if I talk about it. We've talked about this.
I don't care.
I mean, Sarah's, a lot of Sarah's preventative, because she's pretty young. Like she's, too young to just have like a bunch. Although people at your age could.
Yeah, I mean, I already look pretty young naturally.
Yeah.
I've been told.
Yeah.
So
you do.
Yeah, I just got it because I just started noticing it more when I put on makeup. I don't notice the wrinkles usually whenever I'm not wearing makeup. It's whenever makeup gets like in the creases.
Right. But with the Botox, you think it's better?
Yeah, I don't notice it.
Yeah.
There is none.
Yeah. That's great.
So.
I think yours looks really good. Who did it? I'm just
You.
kidding. I know, I'm just kidding.
Did you forget?
No, I was just messing
Take your
with you.
medicine.
I was like fishing for compliments.
It's so good.
All right. Well, very good. We'll keep an eye on Vanessa Williams and see what she's done. So I think that is all the time we have today. 4 segments. Let us know what you guys want us to talk about. We always love people commenting. If you have a topic that you want to know about, medical, plastic surgery, health, beauty, we can cover a lot of topics here. We would love to hear from you. Thank you guys so much for tuning in, and we will catch you next week.